My name's Alison Gornall, and I'm the team leader at Big Noise Govanhill here in Glasgow, which is Sistema Scotland's second centre in Scotland. I've got 10 minutes to tell you a little bit about the history of Sistema Scotland and how we started and what we do now, before I pass over to Chris Harkins from Glasgow Centre for Population Health to tell you a little bit about the evaluation that they've been doing of the programme. So, that's us. Oh, there's our live tweets. But don't keep your head on your phones looking at the live tweets. A lot of what I might touch on now might whisk you away into a sort of music-y world, but I hope that you can see the benefits behind the programme that are really wide-ranging, and I think you'll be able to pull some of them out that relate to the work that some of you are doing. Some of you may have heard of El Sistema, and some of you may not. And El Sistema is a program that happens across the world in Venezuela, and it's been going since 1975. And it's most renowned for its musical outputs and world-class conductors and instrumentalists. However, they work with about 250,000 of children over there, making beautiful music and having a really inspiring time and giving those young people purpose and drive. In 2006, the chair of our board, Richard Holloway, went over to Venezuela to see what was going on over there, and he was absolutely blown away when he saw what was happening. And he said, this is what I'd like to have in Scotland. So he came back and started to make that happen. He was really tired of seeing the same damaging cyclical problems in Scotland's most poor communities, and he wanted a different way to help deprived areas come out of these deep-seated problems. So in 2007, we established the first Big Noise programme in Raploch in Stirling. And in 2000, that was just with a chief executive and a small board. And then in 2008, we had a small team working there, and we launched the programme in Stirling. And I'll tell you a little bit more about that in a minute. So Sistema Scotland, we're a social transformation programme. We're committed to working in Scotland's most deprived communities, and we believe that transformation will be seen through the delivery of a high-quality, inclusive and immersive music programme. And here are our aims up here: transform children's lives through music, empower communities and grow future orchestras. So transforming children's lives through music. We believe we can do that by developing new opportunities, fostering confidence, building self-esteem, aspiration, skills, and peer networks. Empowering communities, developing parent skills and confidence, wider networks, ambitions and opportunities, and working with local partners to bridge gaps within communities. And the last one there, grow future orchestras. Orchestras that are for everyone, delivering high-quality music programme and giving extra support and encouragement to all those involved, both practical and personal. So as I said, we launched in Raploch in 2008, and I'll tell you a little bit about where we are now. But when I think back, I was there in 2008, so I'll try not to go down memory lane just now, but I'm there in the top left-hand box playing a double bass on a bus, on a double-decker bus. We were 6 musicians starting off in the beginning, and we had a little launch programme in the community where we played on double-decker buses. We played outside the post office, in the bingo hall, in McDonald's, at the football disco. You couldn't get away from us. We were in the schools at that time in the Raploch community, working with the kids in the school day. And we taught them a little bit of music on a short-term basis, and then we had a big launch concert, which is the image on the right, in a marquee in the playing fields. We brought everyone together to celebrate what the children had achieved in a short space of time, and then we said to the children, you can come along now to our summer club, and that's how it all started. So these kids in Raploch started coming voluntarily during the summer, and then we continued with the programme from there, delivering in school and after school. We started off with strings, later on we added woodwind, brass and percussion, and eventually we developed the symphony orchestra there. And you're going to hear from some of the string players, some of whom might have been there actually in 2008, right at the beginning. So where are we at now? Well, we now have 3 centres across Scotland. in different communities. We launched in Govanhill in 2013 and were heavily involved with the Govanhill Housing Association to bring us there. And we launched in Torry just last year in 2015. So these are really different communities. I don't know if any of you know Govanhill or if you know Torry in Aberdeen, but they're very different communities, but we're running a very similar core programme. We've grown from 6 musicians in 2008, and I think we have a staff of around 70 just now. And this is an estimation, and Chris might know this better than me, but I think we work with about 1,500 kids, or roughly that, every week over those 3 communities. So the core programme, as I said, is similar in each of those centres that you go to. However, we recognise and adapt to the communities we work in and have to have different ways of working. The core programme I'm just going to talk about just now. So we work in all the primary schools and the nurseries in each of the communities, and we believe strongly in early intervention, early development of skills at that basic age between 0 and 5, the development and the learning that you can put in there. So we run our own baby classes in the communities that we work in, and then we partner up and we work through the nurseries and through the primary schools with the primary 1s and 2s. So this is all compulsory, the nurseries and primary 1s and 2s. They don't get an option with that. And you can see a little bit of what we do. In the nursery, baby section nursery, and in the starter primary 1s, it's all about embedding a basic music foundation for them. We use the voice a lot. It's a lot of singing. And then we gradually introduce some basic percussion instruments. And we're encouraging the children to build up to joining the optional part, the after-school orchestra. So we introduce the string instruments, first of all. And this is something that we've copied from Venezuela, and we've learned a lot from what they do there. The children in the middle there, with those really shiny instruments, the instruments actually aren't that shiny normally. So they've made paper replicas of the string instruments. And that's a process we do with all of the primary 2s. They choose an instrument and they make it out of paper, and we find it a really interesting and lovely time to have with the children. And they form quite a good attachment to the instrument that they're making, and they learn to love it before they've even had the real thing. They also then have lots of rehearsals that are silent, which is amazing. Then we give them the real things, which is super exciting and super noisy. A lot of the stuff that we do in the daytime, we actually work as a team, so you won't just have one big noise teacher, musician in the classroom, you maybe have a couple of us. And I think that adds a bit of dynamic when the children see us team teaching in this way as well. It's quite interesting, that follows on to the after-school programme as well. So the after-school club is the largest part of the programme. It's where we form the symphony orchestra, and it is where the children come voluntarily. So we hope that they want to come, maybe with a little bit of help from their parents, shoving them in the right direction. The after-school programme is inclusive and immersive. It happens up to 4 nights a week, up to 2.5 hours a night. But anybody can come. We welcome people from the 4 primary schools and anyone living within the community. So if you attend school outside of the community but you live within it, you can come along. The children are learning mostly in groups. So it's very different to the approach of music where you normally get taught in a classroom one-to-one until you're good enough to go to an orchestra. The children are in an orchestra straight away, and that's an insight into what we're there for. We are using music, but actually we want people to learn skills about working together, about participation, and about a shared sense of joy, really, when you're involving yourself with music. But that's a real challenge. The kids are absolutely knackered at the end of the day, and they're sitting with other children from different schools that they don't know, and you're asking them to learn something really hard, actually. I don't know if any of you play music and know notation, reading, working with other people around you. So it is a hard level of learning for them. We have a lot of contact with the schools and the families, and one of the things I did want to point out about the after-school programme is that we see the parents of the children every night when they come to pick up. So we actually do a lot of individual support through that, and a lot of work with the parents on encouraging the ways that their children are engaging, teaching the parents a bit about what they're learning, and getting to know the families and the situations that they might be in. Here's a wee list of what we provide. Some of these are only in the Glasgow Centre because they involve the teenage children, things like the youth board and the young leaders there at the bottom. I'm speeding on now. So a couple of other things just to tell you about that we try to do as well. There's not just the after-school programme. We also have various trips for the children. We hold residentials, which is always an exciting and a bit of a learning curve for them. We take them to concerts. We have partners with different organisations. And one of the things we do throughout, we run summer school and October club and Easter club. We never close. And in those periods of time, we like to do home visits, which is a little picture there in the bottom left with a child and her grandma. We take the instruments round to the house. We play a little concert. The child performs on their instrument as well, if they're up for that. And that's an amazing way to get a link into the family. People at home who maybe can't make it out to the concerts, people in the family who don't have confidence to go and put themselves in that situation, we'll actually bring it to you and you can see what your child is doing. We also have an adult orchestra at each of the centres, engaging with parents and community members. We work with all our local partners, so it's not just the schools, so community groups, social work, police, health. And then we have key musical partners with the BBC Scottish Symphony Orchestra, organisations like National Youth Orchestra of Scotland and National Youth Choirs, and the Royal Conservatoire just down the road. So we are trying to, these children, we don't want to keep them forever in their own little bubble at Big Noise. You know, part of this learning curve is to get out there and be able to participate and have the confidence to be involved in other things out there. So we are about generational change as well. We do recognise we're not a short-term project, we are a long-term programme. We're committed to communities, we're committed to developing pathways and opportunities, and we recognise that it's not just material regeneration that communities really need. That's it for me. Over to Chris.
Thank you very much, Ali, for that wonderful overview. Over to me, right, that's me. I realise with the benefit of hindsight, ladies and gentlemen, it's quite an ambitious title to have for a 10-minute talk. We will touch upon the complexity of evaluating an initiative like Big Noise, different forms of evidence, and I'll describe for you the life course study that we're planning at the GCPH. I'll just be doing it really, really quickly. So why is the GCPH interested in evaluating the Big Noise and working with Sistema Scotland? Well, a range of studies from Scandinavia show that regular engagement with arts and cultural events independently predicts a healthier, longer life. Quite convincing evidence there, irrespective of your socio-economic background, employment status, current health conditions, and so on. There's also interesting evidence which shows that learning an instrument over the school years predicts better educational attainment. No evidence base is perfect. There are quite big gaps in evidence concerning the pathways between arts and health outcomes, and importantly, as Claire touched on, how to conceptualise delivery on the ground. What does an effective arts-based programme look like on the ground, and how can it impact on inequality? We're also interested in Big Noise from the point of view of regeneration. Holistic regeneration acts on important determinants of health, as we know. Findings from our Go Well study at the GCPH and evidence from across the globe shows that social regeneration, such as the Big Noise programme, tends to occupy something of a lesser status in comparison to the more easily identified physical and economic regeneration. So there's gaps in evidence there around how to implement social interventions and how indeed to evaluate them. If you're interested in any of that, I can direct you to the GCPH website. As part of this evaluation, we commissioned 3 systematic reviews to look at the evidence behind this. There's also a very brief narrative synthesis of the 3 reviews, very accessible, just about 10 pages. If you can't find it, please get in touch with me and I'll make sure you get it. Just to touch upon the vision behind the evaluation, quite ambitious really. We wanted a very high quality evaluation, but with relatively low cost. So it was decided to be quite bold from the outset, to ask a range of partners to be involved and to get multiple perspectives involved in this evaluation. I don't have actually that much time to tell you what they did, but there was a number of partners involved. Importantly, it's a life course evaluation. I think that's one of the things which maybe distinguishes it from most kind of community-based evaluations. It has a formative and summative design. We value different forms of evidence. We very much wanted to capture the human experience of being involved in the big noise, but also to measure the impacts in more abstract ways as well. We did not want to be disruptive to a fast-paced programme. I think you got a bit of a sense from Ali there that they do work at breakneck speed in the big noise. We didn't want to disrupt the programme in any way, and we didn't want to be intrusive to participants' lives. We were very sensitive to the fact that we didn't want to reinforce any messages that the children were living in disadvantaged areas and were receiving a special intervention, if you like, to try and to help them in that regard. For many of the children involved, the big noise is just a normal part of their daily life and their community. So we didn't want to be too intrusive in the participants' lives. We've got a senior advisory group, which is really, really helpful. We're constantly reflecting on our own methods. So the plan, we do have an evaluation plan on the GCPH website, but we move things as we go. And we're aiming for societal impact and influence with the work. The aims, again, are on the GCPH website. There's a lot of detail around them, but basically what are the impacts and how are they achieved is the crux of it. My good colleagues Bruce White and David Walsh asked me to put in a graph, said you'd like a graph. This is the closest I can come to it, a bit of a diagram here. Just to give you a bit of an overview and a timeline, just hopefully you'll get a sense of the kind of work we're doing. It is a life course evaluation, so that involves tracking the big noise participants' outcomes for decades ahead. 2 phases to the evaluation. The first phase is the formative part, which is about learning from a developing programme and helping the programme develop as well as part of the evaluation. And what we've done there is rely mainly on qualitative methods, but a real depth of qualitative methods, which I'll outline for you. And we're observing the impacts that are observable at this stage, and we're trying to get a very, very detailed understanding of the programme. So that's phase 1. Phase 2 is the summative part, which relies more on quantitative outcome measures, looking at routine data from education, health, social care, the welfare system and the justice system. And essentially what we'll be doing there, we have ethical approval for all of this, is to identify a control group within each local authority area of obviously similar children, similar socio-demographic profile, and as we move forward in the decades ahead, we'll compare these outcomes from these partner agencies between the big noise participants and the control group, and hopefully arrive at an understanding of the big noise effect and the influence it has on these outcomes. So phase 1 started in 2013. First report was in 2015. That was a report of the big noise Govanhill and Raploch. We're delivering a report on the big noise Tory later this year, and then we're doing a 3 sites review in 2017. Again, that's all primarily qualitative in nature. 2020 is the first part of the summative evaluation, a very important one, as I'll talk about just very briefly in terms of the pathways we've identified. For some of the big noise Raploch participants, around about 140 of them will be leaving school by 2020, and we'll be able to do an analysis of their educational attendance, attainment and post-school destination, again comparing it to the control group. Just to give you a feel for the timelines, these aren't set in stone. By around about 2025, we will do some preliminary work around looking at the contact with social care, the welfare system and the justice system for, again, some of the big noise Raploch participants. By around about 2040, we might do some preliminary work around health outcomes. Now, sadly, I'll still be working in 2040, but there is a bit of a question, will the GCPH still be in existence? We hope so, but at the same time, maybe the health of Glasgow and the West will be in the part of the rest of Scotland, and we might not be as much of a use for us. So what we're trying to do there is embed a very transparent evaluation design. If the GCPH isn't there, others can pick up the work. We are making a concerted effort to document everything we do, and we're fortunate in that we do have senior support for the work. So if we can't do it, others could pick up this work quite easily. Short-term methods, very much qualitative as I described. There's a real, hopefully quite a depth there. Interviews with participants, parents, teachers, musicians, stakeholders, structured observation, participant drawing exercise, age-appropriate methods for some of the younger children, filmmaking, case studies, focus groups for non-participants. And what these methods have enabled us to do is develop theories of change for the impacts of the programme, and also to develop process learning insights. It's absolutely vital that we understand how these impacts are achieved. So just some very quick findings, running out of time, but impacts on the children, the younger children involved, definite improvements to confidence, pride, happiness, self-esteem, discipline and attitude. A lot of our qualitative methods were very deliberate in trying to assess what additionality the big noise brings on top of parenting and schooling and so on. The impacts we observed among some of the older participants, the teenagers, was improvements in collaboration, cooperation skills, motivation and determination, the development of positive peer groups within their community and out with their community, and a real aspiration for higher education and continuing their learning. The depth of the methods we used enabled us to piece together pathways on the right. So going into a bit more detail, we were able to categorize and develop these pathways. And they are like boosting learning and education, life skills, securing mental and emotional well-being, social skills, respite and protection for particularly vulnerable children, musical skills and healthy behaviours. Important to those pathways that we've identified is the principles for delivery. Ali's touched on a lot of these. The longevity and the commitment that Big Noise make to communities is very important. They're a very stable part of the children's lives, and that's absolutely essential. It's inclusive, innovative and flexible in terms of how it continually adapts to maintain a good level of engagement with the children. It's intensive, as Ali said. It's a collective experience. The programme is the pursuit of excellence in the programme delivery, and musical excellence we feel is an important part of all of this, and a real focus on the relationship between the musician and the participants is absolutely central to the impacts we observed. So all of these things taken into account, the pathways we've observed play important determinants of health. I hope you can see that. I'm not going into it in any depth, but there's the potential there to improve the health of the participants in the long term and to address inequalities. The key word at this stage is potential. We've also delivered a range of recommendations to Big Noise, which we hope would improve the programme, but I don't have time to tell you about those. This is just one of the pathways, just to give you a feel for what each of the 7 will look like. Don't worry, I won't talk you through it. But on the left, it's the things we've observed, so the characteristics of the programme outputs, the impacts we've observed up to sort of 10 years, and then using wider, quite well-established evidence, we theorise links beyond that into the future. Just some quick strengths, limitations and challenges. I think the strength of the evaluation is the life course study. It's a good use of routine data which is gathered on all of us, but it's not always used, in my opinion. A depth of short-term qualitative methods. We tried to capture the complexity, the nuance and the generative nature of the work. We've used mixed methods and we have quite a clear plan. Even if decision makers or people who are looking at the evaluation are not particularly of a qualitative mindset, at the very least they can see a strong plan ahead as to how we're going to measure things if that's more the type of evidence that they value. And that has inspired confidence, I think, in some of our stakeholders and funders. The partners, as I said, is a strength, but I haven't even mentioned them, so I'll move on from that. The limitations, it's a qualitative approach in the short term, so there's no assessment of the prevalence of the impacts among the population, nor an understanding of the duration or degree of engagement required to achieve the impacts I've described for you. Impacts on participant mental health and well-being were not assessed using validated measures. Good reasons for that. Cultural and language barriers in Govanhill were a real issue. Age applicability of some of these tools with very young children is not appropriate, and that whole thing about stigma and intrusion, we did not want to go down that path. Challenges, of course, as a life course study, so it requires patience, and there's no shortcuts to the hard indicators that a lot of our stakeholders want to see. And from the GCPH point of view, the resource and the capacity required to undertake the evaluation is a continual challenge. We're always trying to get funding to keep things going. Thank you so much, ladies and gentlemen. I appreciate I've gone through that pretty fast and in not much depth, but I hope it gives you a feel, at least, for the evaluation. If you want to go on the GCPH website, there's a feast of information there about it. If you are really interested in the methods, we've just published in the Journal of Public Health, talking about qualitative ways of assessing impacts to mental health and well-being in children. I can get that paper to you as well. Thank you so much.